Hello, everyone. This is Dr. Mike Chua, physical therapist. Hey, today we've got a special guest for today. Her name is Dr. Ginger Holt. We'll be talking about healing beyond the cut. A conversation with Dr. Ginger Holt. We'll be back in a few seconds. Okay.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
Hello, my Facebook friends, YouTube friends, and whatever friends do we have right now. So check out hellonote.com if you need documentation system. If you are wanting to start your own private practice, check that out. We actually use that in our own private practice. And of course, if you need an education unit for physical therapists, occupational therapists, check out medbridge.com. Use the code alternative or Dr. Mike. Check that out. You get, I think, 40% discount. You make sure to use that code alternative or Dr. Mike. And if you can't find it, just shoot me a message. I'll send you the actual link. Okay. So again, we've got a special guest for today. We are back. We haven't been doing a lot of videos recently, but we've got a special guest for today. Her name is Dr. Ginger Holt. She's a board certified orthopedic oncologist. Listen to this, ladies and gentlemen. We've interviewed oncologists, we've interviewed orthopedics, ortho doctors, but a combination of ortho and onco, this is something. So Dr. Ginger is known for her expertise in treating bone and soft tissue tumors. She's not only a gifted surgeon, but a compassionate leader in her field. We're going to be talking about her journey and her approach to patient care and what she looks for in her practice and in everything that she does. So again, without further ado, let's go ahead and bring in Dr. Ginger Holt. Dr. Ginger, what is going on there?
Hey, Mike.
Well, thank you again, Doc. I know you are a very, very busy person and you run and do your own thing there in Nashville. But could you please tell us again who you are? What do you do as an orthopedic oncologist, and where are you from?
Yeah, I was born and raised in Alabama and went to college and medical school at UAB. I then went to Vanderbilt and did an orthopedic surgery residency, and then went to the University of Toronto to do an orthopedic oncology fellowship. I did a second fellowship in adult reconstruction, so hip and knee replacement and pelvic reconstructions, that sort of thing. And then I actually went back to Vanderbilt, where I trained for about 22 years and recently left to come over to Centennial in September of 2024 to start TriStar Orthopedic Oncology.
Wow. I mean, I was like, you mentioned about you're from Alabama to Toronto. Gosh, I mean, what really go there, right? I mean, is the training there? You did your residency there, right? Is that like a
My
specialist
residency was at
training there in
Vanderbilt.
Toronto?
Residency was at Vanderbilt, and then I went to Toronto for this specialty training. Orthopedic oncology as a specialty is the most rare subspecialty in orthopedic surgery. There aren't a lot of...
I was going to ask that,
Yeah.
It's so rare.
There aren't a lot of orthopedic tumors, and there are two types of orthopedic tumors. There are types that start in the bone and grow in the bone, and then there are ones that come from other places and land in the bone. And so there, at the time I was going out to train, there were probably only 8 centers in North America where you could really train in this subspecialty. And Toronto was just one of the biggest. At the time it was growing. And I thought I would take one chance to live where it snows a lot and where it's really cold, because I wasn't going to live like that permanently. So 1 year, one and done, and then back to the South.
Wow. So, well, I know, like what you said, it's very rare that we get to interact with, I mean, of course, orthos are are amazing in oncologists, and then a combination of both, like what you said, an actual tumor in the bone. I mean, and then you mentioned that that's really your specialty. Let me go to that question here. What inspired you really to pursue this career in orthopedic oncology, and how did your diverse training shape the way you are taking care of your patients today? I mean, do they
Yeah,
go to you? Okay, let's go to Dr. Holt. She's the expert. Is that the really it is?
yeah. It takes time, no matter who you are or what you do, to build a practice and build relationships. And um, mostly, when a patient is seen, they are referred by a physician. So people don't really look at their, for regular orthopedic issues, people have knee pain. They say, I'm going to go see, an orthopedic doctor. Who do I like? Or maybe we have someone in the family that we see and visit, and then you kind of refer yourself and go get seen. We get sent patients by medical oncologists, by orthopedic surgeons. So people sort of have to know who you are and that you exist in order to send you patients. And I really, when I was doing my orthopedic surgery residency, I really loved the physical aspects of orthopedic surgery and all the challenges of the surgery. But I had encountered a couple of orthopedic oncologists, and I really appreciated the deeper connection that you get with patients when they're going through a tough time. They're facing their mortality. I also take care of children. And so working through with families, just a very difficult process of dealing with not only your mortality, is this problem that I'm dealing with potentially going to be fatal? Could it end my life? But if I survive, how am I going to function, and how am I going to be able to deal with maybe losing a big piece of bone in my leg? Or what if I have a cancer that's really bad and I have to lose my arm? And I was very much drawn to the physical challenges and all the challenges that come with orthopedic surgery on a bigger and bigger scale, but also walking through that journey with patients, and now being able to have a team and create a team that can do that. I'm one person and I sort of have my role in what I do, but having a solid team that helps with the patient and really taking care of the complete patient has become the most important and enjoyable part of my work and what I do.
Oh, actually, I was going to ask you that, Doc. I mean, the aspect of being an orthopedic doctor is more like skeletal, and then you got the onco part, wherein okay, you got this cancer and everything, and then for me as a, let's just say, a regular person, it's very hard to be an ortho slash onco, and then you're dealing, like what you said, you're dealing with not just the functional mobility of that person or that patient, and also the whole aspect of either an actual surgery, removal of the limb, or like what you said, the mortality of that person. And you mentioned about the age too, a young person, an older person, it's probably different. And you mentioned about a team. How many are you there in your team, Dr. Holt? Do you have like you, of
Yeah,
course, your therapist, and I mean,
yeah, the
do you
team
have a social
is
worker?
small but big.
Mm-hmm.
Yeah, we have I have a PA, so a physician's assistant, who is just critical in helping manage patients. When I'm in the operating room and I'm busy and can't talk to people, she's able to really manage all those problems. We have an outstanding nurse who answers the phone, and getting patients in who have had cancer care and orthopedic care and getting that all coordinated is very complex. We have to have a cast tech who also works as a physician assistant. And then we have, a team who helps prep and get the implants ready. We actually, for some of these unusual tumors that we remove, have to make implants. And so we work with a team of engineers through a couple of companies that will make 3-dimensional models, and then from that we'll make either machined or 3D printed implants. So if we're removing sort of part of someone's pelvis and we have to recreate a pelvis for them, we have to have a group and a team that helps do that. And then, there's the team in the operating room who help assist with that sort of stuff. Doing all the surgery and making sure all the parts are there. The physical therapists after the surgery are critical in helping patients have the confidence to be able to walk or ambulate or sit. Anyone who has had a hip replacement or a shoulder replacement knows that there's a time where we have to be very, very careful as the tissues are healing. And so I'm not there 24 hours a day with the patient, and someone like a physical therapist who is giving them the confidence to know that they need to move, they can move, that getting their strength is very, very important. And so I think the team is more important than I am, because they spend so much time with the patient. They're either on the phone helping them understand their medications, they're navigating them through the system of understanding their diagnosis, and then maybe they're going to get chemotherapy and radiation, and then sort of a big surgery, or after when they have this brand new fancy implant and they have had this surgery, and then they just don't know what to do. And, motion is life, function is life. If the whole point of this surgery and what we do is to keep people active and engaging with their families and engaging in life, we really have to get them mobile and moving. So you can see I'm just one piece of this really big team that is very, very complex. And that doesn't, count the radiation oncologists, the medical oncologists, and a lot of the other members of the team that help take care of these patients. Part of what I
love how you're shared. Go ahead.
Yeah, well, I was going to say part of being an orthopedic oncologist isn't just always dealing with cancers. We also see sort of the disaster problems that, a patient who may have had a joint replacement that has failed once or twice or been infected, or a patient who's had a really bad trauma or car crash, and they've had a really big problem and lost a lot of bone. So there's a concept of limb salvage. And so I also end up seeing plenty of patients who have never had cancer, thankfully, but may have lost a large piece of bone due to trauma, infection, or some other issue. And so those people end up with me as well, trying to use all these techniques and the team that we have to sort of recreate a bone or a limb, to give them a functional limb to use or walk on.
Wow. I was going to ask you that. Good thing you answered. So first, I want to commend Dr. Holt. She was talking about her team. It's very important that you have a team that will believe in you and bring out the best in you. And that's what she was doing. She wasn't just focusing on herself. She was focusing on the rest of the team. And just like in our private practice, if you're watching and listening right now, especially to our team, to our clinics, clinic director and all the therapists there, I wouldn't be able to do this without our team. And same thing with Dr. Holt. It's very important that you encourage and empower your team yourself. So I also like what Dr. Holt mentioned about she's not only seeing orthopedic onco, she's seeing other patients who luckily she said no, some don't have a cancer. So same thing in geriatrics. Yes, we quote unquote specialize in geriatrics, but we see workers comp too, right? We see every now and then pediatric cases. So but we do have a specialty of geriatrics, and same thing with Dr. Holt. She has this specialization of orthopedic oncology, and she see that? Of course, that's her specialty, but she also see other orthopedic cases too. Thank you for pointing out to Dr. Holt. Dr. Holt, since on that same note, you've seen a wide range of complex cases. What have been some of the most rewarding and challenging moment in your practice, and how do you maintain resilience through it all?
Well, I think as you mentioned, your team, the days that you aren't maybe feeling as great, your team lifts you up. There are the days that you're feeling more empowered and you have to lift your team up. We also hold each other accountable. If we don't feel like we are doing a good job, I expect any member of my team to, call me out on it. If they think I could have done better with a patient, if I could have done better on a surgery, having those team members, because they know the truth, they know sort of the behind the scenes of everything that's happening. So I really rely on the team. Any team member to, like I say, hold me accountable. We hold each other accountable for doing a great job for our patients. And, maybe there's a day where I have less time and the team member has more time and vice versa. Some of my favorite patients, I really appreciate the patients who inspire. I always tell my patients when they may ask, oh, how long does it take to recover? Or, am I ever going to be able to run again? I always tell the patients, prove me wrong, surprise me. We as physicians can only use a lot of our experience. We use data, we use the literature and things to sort of give people guidelines as to what they can or can't do. But the patients who come in, I had a patient who had a tumor in his arm, he had a mass in his arm and about here in his forearm, and we had to do an amputation sort of on the upper part of his forearm above the wrist. And he created for himself sort of building off of a prosthetic part, something where he could fish, something where he could hunt. He had a thing that he could use. He had his own little fly tying apparatus that he could use. And, people are amazing and people are so clever. And I absolutely love seeing what people come up with. I always appreciate our young patients who we sort of march through their journey and through their life with them, and having young women who may have undergone cancer when they were younger, I see graduate from high school, go to college, get a career in nursing. They maybe want to give back to the field. They end up getting married, having children, and really seeing people succeed, overcome. It was a big thing for me. I was an athlete. I was a collegiate athlete, like a lot of orthopedic surgeons, loved sports, played basketball in college, and had always thought that I would do sports medicine as a career and take care of athletes. And when I was a resident and worked with the oncology patients, and then went and did sports and worked with the sports patients, there was a clear difference to me in who inspired me to want to do better and do bigger and just to make me better. And that was very much the cancer patient or the patient who had a limb deficit that we were trying to restore. It's just so much more inspiring to me what these people go through and what they face. And I think every day when I leave the hospital, I have both my arms, I have both my legs, I'm healthy, I'm ahead of the game. And anything beyond that is just is extra. And so it's that patient and that that cancer patient, that patient who's gone through a lot, who they have the resilience and the grit and overcome, that I love sitting and talking with them, or they'll email me, or we send pictures back and forth. So that's why I get up easily every day and just charge into work fully energized, because the people we get to take care of are fantastic and extraordinary.
Well, thank you for pointing that out too, Doc. Aside from running our outpatient clinic, I also run and moderate a group called Alternative Healthcare Careers for Rehab Professional. And there are a lot of healthcare professionals are really burned out. And I always try to encourage them, hey, go back to your first love. Go back why you wanted to do to be a therapist, to be a physician, to be a nurse. Think about that, going back to your first love. And then, like what you said, because you see that inspiration, you go back to your work charged up. And the same thing with me, every time I see a patient or elderly, we specialize in geriatrics now. And every time I see an elderly person or a senior getting up from the floor, getting better and stronger, recovering from their hip and knee replacement, I feel like, oh gosh, this is why we do it. And same thing with Dr. Holt. She mentioned about, hey, this is why we do it. Go back to your first love, ladies and gentlemen. Dr. Holt, let me ask you this last question here. Collaboration is the key to patient recovery. What qualities do you look for in the people that you refer to, your therapy clinic or your PA, those recovering from orthopedic cancer surgeries? Is there a special skills that you're looking for from us, from therapists, or from your PAs, or from your nursing team, or home health people, or something like that? Is there a special protocol that you give out?
Yeah, most people, physical therapists are quite familiar with a hip replacement or a knee replacement. And, I always send pictures to the therapist. I try to give the patient pictures so that people can look at what they have had done. Because when someone says, oh, they had to take out my femur bone and sort of do a hip replacement, well, that doesn't at all give the full picture of what the patient had. When we've had to remove half of their femur and replace their femur with a large metal implant and a hip replacement, that's 5 times the size of what a standard hip replacement is. And there's a constant education for the patient to let them know that, you're going to be next to someone who did truly have a basic hip replacement, and you can't compare yourself to what they had or what was done. But I think that what we all want for ourselves and what we want for our patients is the person that goes the extra mile. Patients who come in to me and say, oh, my physical therapist, they worked with me a few times and they kind of passed me off to someone else. It was like they were bored, or I'm not sure if they knew what they were doing. And I absolutely love it when a physical therapist emails me or calls me and says, hey, I don't understand this implant or this prosthesis. What can I do for this patient? And how can I get them better, and teach me about this? Or, someone who says, hey, my therapist and I sat down online together and looked at this implant, and, can you tell me the company? Because we want to look at it further and understand and learn. And I think probably some of what you said about being burned out and people who, you look at your list for the day and you look at the patients that you have, and you look at all the documentation that you have. And, sometimes you just have to cut back a little bit and be able to spend that time with the patient. That energizes you, and getting to know the person and talking with them about what they do and what they like to do, and then educating yourself about, and it's fun to learn that your patient, may be a pickleball player, or there's a new game I'm learning about called padiddle or paddle. That is a combination of racquetball and pickleball. And to learn from people, talk to them about what they're doing and how they do it. And gosh, as a physical therapist, knowing what people do throughout the day and everything that they do, what kind of car do they drive? You just learn so much from people. And so I appreciate the people who are curious, who want to learn, who want to get better, because that helps other people get better. And like I say, if you sit and talk with your patient for a little bit, man, you can learn so much about them and just about life and how interesting they are. And I think when you get that connection, it's more healing for patients. They know that you care, something about them when they come back to clinic, and you can ask them about something. We all go to the doctor and we know what it's like to feel like we're sort of on the conveyor belt getting things done, versus when the doctor leans back for a minute and says, hey, how's your dog Cookie? Last time you got a new puppy, named Cookie, tell me about Cookie, and can you take Cookie for walks? What can you do? So I like to do that. I was taught to do that, and I love having my team members or people who do that. Or if I have the choice, when I have a patient who comes in and said, oh my gosh, I had this awesome physical therapist, I'm like, I'm writing the name down. And that's where I want my patients to go is by other people who are energetic, inspired, and curious, and continually want to learn.
Yeah, it's so true. Thank you for pointing out that, Doc, that always being interesting, always not being interesting, but being interested. Because we all are interesting already. We got all the titles and degrees behind your names. But if you become interested enough with your patients, oh gosh, those patients will be your fans forever, ladies and gentlemen. So that's what Dr. Holt is talk about. Be interested in your patients, and then you'll learn a lot more. Just like what she was talking about. She was talking about, hey, how's your dog Cookie? Stuff like that. Simple. Go ahead and write it down. You can put that on the EMR, on your electronic medical record. Put it down there. Stuff that the patient is interested in, because that could be actually your functional goals. If the patient wants to walk the dog, patient will walk X amount of feet while not being pulled by their dog. Because they need upper body strength too, right, Doc? So
That's
again,
right.
Dr. Holt, thank you very much. I know you're a very busy person. Thank you for your time. I appreciate you. Last question: where can we find you? Is there a best number or website that they can reach you? I know I can post Hope's information, but those little stuff like
Yeah.
that. And last encouragement. So
Yeah, if we can be of help, I'm at TriStar Orthopedic Oncology. If you either just go to the internet and Google TriStar Orthopedic Oncology, or Ginger Holt, MD, the website for TriStar Orthopedic Oncology comes up. I'm at Centennial Hospital in the heart of Nashville. We have easy access, valet parking. I see a ton of patients with osteoporosis, and again, sometimes people who have bone problems that are very difficult to manage for orthopedic surgeons when there's osteoporosis, thin bones, or bone loss. We totally handle that. So again, it doesn't just have to be cancer, but we're at Centennial Hospital. Find us on the internet or call Mike if you can't find us, and he'll get you in contact. And Mike, thanks so much for having me today. This is so much fun. Thank you.
Well, thanks again, Dr. Holt. I appreciate you. I would love for this to be like, I know this is like an intro show or podcast for us, but I would love to dive in, in the next few, I'll reach out to Hope, hey, what is this specific condition that you really wanted to talk about? Hey, hip replacement, or, a vascular necrosis. What is a vascular necrosis? Stuff like that. What is the specific equipment, or, because we just want to put up education for our patients. I don't, I hope I make money from or the YouTube. We don't have, millions of views. I make like probably very, very little on our YouTube, but the goal is for me to educate our patients, give out this valuable information to them. So again, thank you very much, Dr. Holt. Appreciate you. But before I let you go, ladies and gentlemen, always remember the word FAST, F-A-S-T. Letter F, find people. Letter F is find people that will bring out the best in you, because you are the average of the 5 people you hang out with. So today, I hang out with Dr. Holt. I feel like, I want to read more on my, not just ortho. I can probably, talk about ortho a little bit. Onco, it's like, oh, what are those type of cancers? So find those people that will bring out the best in you. Even when you have orthopedic issue or onco issues or cancer issues, find the best, find those best ortho onco in your area. Next letter is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not even going to do Dr. Holt good if you don't take action. Take action. Go to their website. Sign up to their email list. I'm sure they have that email list. Just talk to them. Hey, what can I do? Talk to your primary care physician. Hey, could you refer me to TriStar Med Group? Next is letter S. Shoot for the moon. Why? If you keep shooting for the moon, you're going to miss it, but you're going to be landing with the stars. And last but not the least is letter T. Is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, and that's what Dr. Holt is doing. She's not just doing surgery all day long. She's teaching you too, guys. She's going to teach you when you go there, how to do this, how to do that, and everything. Again, thank you very much. Be awesome. Be great. Be excellent. Any last parting wisdom, Dr. Holt?
Stay safe. Stay positive.
All right. Well, again, thank you very much. Be awesome, be great, be excellent, and we'll see you in the next episode.
Hello Note is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. Hello Note reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines